Hi everyone, we're getting ready to start the presentation about ICHRA, a comprehensive guide. Does look like there's a lot of people joining us, but we want to go ahead and get started on time. So I will let you know that we're going to have questions and answers at the end of the presentation. So if you have any questions, go ahead and write them in the question box, and we'll get to that to the end. I do expect the presentation to take close to the full hour. So, however, I will stay on and answer as many questions that come in afterwards. So if you're able to hang on, great. If not, everyone will be given a link to the recording that will include the question and answers, and that will be emailed to you in about 1 to 2 days. So you'll have it there as well. So if you haven't already, we do recommend to go ahead and subscribe to our weekly Monday Minute newsletter so that you can get all the latest industry news and updates. My name is Lael Reitler. I am an ICHRA specialist here at Cornerstone. A little bit about myself. I have been with Cornerstone since January of this year. Prior to this, I was with an independent agency for the last 10 years where I was their health and benefits manager for their 4 locations, where I sold and serviced group health and benefits, individual under 65 insurance, and Medicare. So I've been where you guys all are. I understand the issues and things that we need that goes along in our industry. So I definitely want to be here for you and help you in whatever way I can. So I'm a little nervous. This is my first group webinar. I've had a ton of in-person presentations that I've done, but I've not done a group webinar. So I was talking to my husband last night about it, and I said, I'd much rather be in person in front of 80 people versus a webinar. And he said, you're like the only person in the world that would want to do in-person versus webinar. I don't know. So I kind of feel like I'm talking to myself. Like, I think that's why. So sorry, but please don't judge me too harshly. I'll try to do my best here. So it looks like, yeah, we still don't have, there's still a lot coming on, but we're going to go ahead and get started. They'll just have to listen to the recording. So, all right, ICHRAs, a comprehensive guide. So what is an ICHRA? ICHRA stands for Individual Coverage Health Reimbursement Arrangement. It is a type of health reimbursement arrangement that allows employers to provide tax-free reimbursements for employees to go out and get their own individual health insurance premiums. They also can allow the ICHRA to reimburse employees for qualified medical expenses. An ICHRA is a group health plan, and it is subject to ERISA, as well as other regulations, which we'll go through later on. ICHRA is pretty new. It became effective January 1, 2020, so only a little over 4 years old. So it's a really great product. You're going to find out here soon. So the benefits for employers: they're going to have the ability to define monthly contributions that they will give to the employees to pay for their individual health insurance premiums. So they're going to have that cost control. They have simplified administration. They can offer the ICHRA and use that to attract and retain talent. So they can let incoming employees that they're trying to attract, we do have group health insurance benefits. And then also it is tax favorable. So employers can take a federal income tax deduction for the ICHRA contributions. So no payroll taxes on that. Benefits for employees: they're going to have the ability to choose their own health insurance, a plan that was going to best meet the needs of for themselves and their families. And then they will have tax advantages as well, because the reimbursements that they receive will be tax-free. All right, so how can an employee be eligible? So employees must be enrolled in a qualified individual health insurance plan to receive those reimbursements. That means the health insurance plan that they enroll in has to meet the ACA guidelines. So your short-term policy, your health share ministry policies, those don't meet those guidelines. So you cannot use ICHRA dollars to reimburse employees for those kinds of plans. You cannot use ICHRA dollars for an employee to be on their spouse's employer plan. You can use the ICHRA dollars to reimburse coverage that is purchased through the exchange, whether it's state or federal exchange. You can use it off exchange, so direct through carriers. You can use it to reimburse for student health insurance, catastrophic health insurance. And the other really cool thing is that you can use ICHRA dollars to pay for Medicare premiums. So there really is nothing else out there that allows that. So an employer doesn't have to, but they can choose to allow the ICHRA dollars to reimburse their Medicare eligible employees. But that would be for Part A if they do have premiums for Part A. Part B, Part C, which is your Medicare Advantage plans, Part D, which is your prescription plans, or your Medicare supplement plan. So an employer can choose to allow the ICHRA dollars to cover all those parts or maybe only certain parts. And we'll get into all of that later on, but that is just like one of the coolest features, I think, that there's so many cool features. I'm very passionate about ICHRA, so if you don't know this, if you can't tell, so there's so many cool features, but that's one of the coolest, I think. So, all right. Determining contribution strategies. Another great benefit of ICHRA is that there's multiple contribution strategies an employer can use when determining how they want to contribute those ICHRA dollars to their employees. So the one thing that I don't know if I want to say the word recommend, but one of the cool things is, yes, I said that ICHRA dollars can be used to reimburse medical expenses. However, by making the ICHRA only available to cover your premium payments, to cover the employee's premium payments for the health insurance, that will allow the ICHRA to be HSA compatible if the employee picks a high deductible health plan through the marketplace that is HSA compatible. The ICHRA, by only allowing the reimbursements to cover the premium, they'll be able to go ahead and contribute to that HSA. Also, the employer will be exempt from non-discrimination testing by only allowing the ICHRA dollars to cover the premiums. So an employer can contribute as little or as much that they want for the ICHRA dollars. It's just that within a class, and we're going to go through that as well, we want to make sure that the employer has to treat everyone the same in that class. So everyone in that class has to be paid the same amount based on whatever contribution strategy they're going to use. Again, we're getting ready to cover that. So there are 4 different contribution strategies. An employer can choose to contribute to all employees equally. So that means no matter what the ages of the employee or how long they've been there or whether they're hourly or salary, everyone's going to get the same amount. So maybe the employer is saying every employee that is eligible, so my full-time employees, or maybe even their part-time employees, because as you're going to find out, you can use ICHRA dollars to reimburse part-time employees as well. Really cool. So let's say they're just saying every employee, they're going to get a flat $400 a month. They can go out and purchase their individual health insurance. So that's one strategy. The other strategy is you could tier the contribution amounts. So if someone's going to only enroll, you only want to make the contribution dollars just to your employees, you can say we're going to give you a flat $400. We're going to make it available to employees and spouses, and if you're tiered in that way, so you're going to have your spouse on as well, we're going to give you a little bit more at $700. Or employee plus one child, we're going to give you $600 for your one child and yourself because your spouse is not going to be on the plan. Or employee plus family, we're going to give a little bit more because there's more mouths that we're going to have to cover here. I do recommend, if they do use this approach, that they would want to have the tiers at not just the 4 that I've listed below, but they would want to do employee plus 1 child, employee plus 2 children, employee plus 3 children, employee plus 3 children or more, employee plus spouse plus 1 child, and so on. And I would max it at the 3 children, and the reason is on the individual market, once you get to 3 children, you could have 3 or 20 children, and it's going to cost the same amount. So it does go up each child from 1 child to 2 children to 3 children, but once you get to 3 children, it doesn't go up any further. So I would leave that at the last contribution strategy tier. So, all right. The third contribution strategy, and this is the most popular strategy, and you'll understand why here once I get done explaining it. So, an employer can choose to tier the contribution amounts based on age. The reason being, on the individual market, the older you are, the more expensive your individual insurance is going to be. The younger you are, it's going to be less expensive. So if an employer is going to do the flat amount contribution strategy, and they give Mr. Employee who's 64, they give him $400, it's very likely that his individual insurance is going to be $800 or more per month. So the employer is giving him $400. Let's just say his premium is $800. Well, now he has to pay $400 out of his own pocket to cover that difference. But let's say your 24-year-old employee, the employer is giving him $400 as well. That 24-year-old individual coverage is probably going to be around $300. So now he's not even using the whole contribution amount. So he has to pay nothing out of his pocket. So it's not really fair if you're wanting to treat employees like give them the same benefit because the 64-year-old is going to have to pay so much more out of his pocket versus the younger employees. So a way to kind of make this more equitable for the employees is to age band the contributions. So you can do this in 1-year increments, 3-year increments, 5, 10, however you want to do it, however the employer wants to do it. So you'll see in the sample, I just did a 5-year age band tier. That seems to be the most popular because typically on the individual market, the rates stay pretty close together in those 5-year age brackets. So, ages 18 to 25, we're going to give them, again, sample. You can use whatever numbers you want. So we're going to give our 18 to 25-year-olds 165. But then we're going to give our 61 to 100, or even further than 100 if you have a over 100-year-old employee, 490 towards their health insurance premiums or Medicare premiums. So this way it's kind of structured more so each employee is going to have pretty much the same amount come out of their pocket to pay for the difference of whatever that premium is minus those ICHRA dollars. And then, yeah, that's what this slide's about. So the one thing to know about the age banding, and this is what we're going to go over on the next slide, but I just kind of want you to look at this. There is a 1-to-3 ratio, so that an employer must keep. So that means if an employer is going to do an age band contribution, his oldest employee cannot be reimbursed more than 3 times what the youngest employee is being reimbursed. So if you have an 18-year-old employee and you have that contribution amount set at $300 for an 18-year-old, you cannot have more than $900 for the 64-year-old. So it has to be that 1-to-3 ratio. All right, so let's move on here. So the fourth strategy is to do a fixed contribution amount based on relationship. So maybe we want to give a flat amount to employees at $500, but we want spouses to not get as much as an employee. So we're going to give them $300. And then each child will get $100 in the example that I put on here. But another really cool thing about doing this is that you can mix the age tier banding with this. So maybe we want our employees to be reimbursed based on their ages, but we do want to give a little bit to spouses, but maybe not as much as what we're giving to our employees. So we're going to give them the flat amount. So every spouse, regardless of their age, is going to get $300. And then we also are just going to give all children $200. Or maybe we want the age banding to be reflective for the spouses, the employees, and the spouses. So then at that point, we'll have the age banding for employees, age banding for spouses, and maybe just a flat amount for children. So a lot of cool different things we can do, and we can be really flexible. So it's, again, another great benefit of having an ICHRA available to your employees. So we can really work with that. All right. So one thing to know with ICHRAs. That's a little bit different than the traditional group health insurance world. In the traditional group health insurance world, we're really used to having employers contribute percentages. It's either they're going to cover 80% of the premiums or 50% of the premiums. Well, on a ICHRA, you cannot use percentages. It does have to be flat amounts. But we can try to get close when we're kind of coming up, helping the employers with the contribution strategies. We can kind of look at what those premiums are, on a spreadsheet, kind of do a percentage, but then create a flat amount based on what those percentages look like. So we can do that, but in the paperwork and everything, it's going to be flat amounts. There's not going to be percentages attached to that. Also, an employer can't offer more to employees that might be going through some medical issues, having a lot of claims. It has to be the same amount based on whatever class they're in, and we're going to get over to the different classes here in just a minute. So, all right, we're here. So employers there are 11 different classes that an employer can structure this benefit. So another really cool feature of an ICHRA. So employers, like I said before, they can offer ICHRA to part-time employees, but maybe they don't want their part-time employees to be getting as much as their full-time. So we're at this point, so then we're going to have two classes for this group. We're going to have the full-time employee class, so your 30 hours or more per week on average employees, and then your part-time employees. And we're going to age band the full-timers, and then the part-timers, maybe we're just going to give them $300 a month. So really cool thing. So there's 11 different classes: full-time employees, part-time employees, employees working in the same geographic location. So maybe the employer has some employees here in Ohio, but maybe they have some in Florida as well. So instead of having all the employees getting the same amount, because in Florida, the individual health insurance is more expensive than Ohio. So maybe we're going to give a little bit more to our Florida employees than we are to our Ohio employees. And again, that's just to make it more equitable for the employees. Maybe we want to offer some benefits to seasonal employees. We can do that with an ICHRA. Employees in a unit of covered by a collective bargaining agreement, so union employees, employees who haven't satisfied the waiting period for coverage. So maybe you have, maybe you're going to keep your traditional group health insurance plan, which you can do with this, and we'll go over it here. But let's say you're keeping your traditional group health insurance plan and you have a 90-day waiting period. You have employees that might not have any health insurance available to them for 90 days. Well, you can have an ICHRA set up just for those people that are in that waiting period. Maybe you want to class it out so that employees that are salary are going to get a different amount versus your hourly employees. Again, something we can do. Staffing firms for their temporary employees. And then, like I said, we can kind of do multiple classes within that. So very cool feature of an ICHRA. All right, so class guidelines. An employer, so if you're within a class, an employer has to make sure that everyone in that class is getting the same contribution. So if you have a full-time class and a part-time class and you've decided to give every employee the flat dollar amount, everyone that's full-time will have to get that same flat dollar amount. Or if you're going to do the age tiering, you can't give a flat dollar amount to one employee that's full-time and the others are doing the age banding. Everyone has to be doing age banding. So just keep that in mind. Every employee within a class needs to be treated the same. Now, so I said that you can keep your traditional group health insurance plan and have an ICHRA. So one class might have the traditional group health insurance plan available to them, and another one we're going to have an ICHRA. So let's use the full-time, part-time employees as an example. So I want to keep the traditional group health insurance plan that I have. My employees like it, it's pretty good. I'm going to keep it for my full-time employees. But I am really struggling with getting part-time workers. So I want to offer them a benefit to help incentivize them to come work for me. So I'm going to let them know, hey, I'm going to give you $300 a month to pay for your individual health insurance if you come work for me on a part-time basis. A group can do that. However, there will be class size rules applicable because they are keeping that traditional group health insurance plan. So this only applies to if they're going to keep that traditional group health insurance plan for some of their employees. So if an employer has less than 100 employees, they have to have at least 10 employees in the ICHRA class that they're going to have available. So if they have less than 10 employees, then unfortunately they're not going to be able to have that ICHRA available for that class. If they are between 100 and 200 employees, there has to be at least 10% of the total number of employees within that class. And let me just make sure, if they don't have to have 10 employees that are enrolled in the ICHRA, they just have to have 10 employees that would be eligible for that ICHRA, or 10% if they're a larger employer. Employers with over 200 employees would have to have at least 20 employees eligible for that ICHRA within that class. So that's just something to keep in mind if an employer is looking to keep their traditional group health insurance. Another really cool thing about ICHRA, I know I keep saying that, but there's just so many cool benefits about it. So there is a special rule for new hires. So let's say the employer wants to get rid of their traditional group health insurance plan, but the employees aren't having it. They want to keep their traditional group health plan. That's what they want. And the employer is trying to make them happy. But he realizes there could be a significant savings in moving to an ICHRA. What he can do is keep the traditional group health plan for those existing employees, and then set up an ICHRA for new hires. So that means that any new hire that comes in doesn't have an option between the traditional group plan or ICHRA. They just are going to be able to get those ICHRA dollars available to them. So any old employees, they don't have an option between ICHRA or traditional. So an employee can never have an option between one of the two. If they're in that class and the ICHRA is being offered, that's what they're getting. Or if they're in that class and they're keeping that traditional group health plan, that's what they're getting. So let's say the employer wants to start an ICHRA January 1, 2025 for new hires. Anyone that is an employee prior to that January 1, 2025 date will have that traditional group health plan. And then anyone that's hired on after that will have the ICHRA dollars available to them. I'm going to take a drink real quick. All right. So, as I said, ICHRAs are applicable. They do have to make sure that they are following ERISA guidelines, as well as ACA guidelines. And as you know, there is an employer mandate for groups that if they are an ALE, and I know I have some agents on here who only sell individuals, so they're not going to be as familiar with this language, so I'm going to do a little explaining. An ALE is an applicable large employer. So if an employer has 50 or more full-time equivalent employees in the prior year, they are considered an ALE. Now, here's another term you might not have heard of, full-time equivalent employees. So it's not just your employees that are working 30 hours or more per week, but we have to calculate the part-time employees. Well, a part-time employee isn't working 30 hours or more per week. So you're getting your spreadsheet and you're calculating all the hours that all the part-time employees have had in that year, and then you're dividing it by the 30 hours. So maybe two part-timers are working 15 hours each. Two part-time employees, each one is working 15 hours a week. Together, they're working 30 hours a week, which equals one employee equivalent. So that's kind of simple terms on how that works, but that's what that ALE stands for. So 50 or more full-time equivalent employees in the prior year, then they're considered an ALE, applicable large employer, and they have a whole set of rules that they have to follow when they have a group plan in place. So if they don't follow the rules and guidelines, they are subject to some steep penalties. One of the guidelines for an ALE is they have to offer health coverage to all of their full-time employees that is considered affordable by ACA guidelines. So we'll talk about what does that mean to be affordable. So it's not just something that if I think it's affordable, it has to follow a specific formula. So And well, I guess we're going to get to that formula in just a minute. So, all right, so the ICHRA will have to be offered to at least 95% of its full-time employees to avoid it's a pretty large penalty for the employer mandate. And we don't have enough time to go over all that. That's a whole nother webinar. So, all right, so, and then the ICHRA has to be considered affordable per ACA guidelines as well to avoid the second penalty that an ALE could receive. So let's talk about that formula. And also, I do want to say that formula is different than the formula that's used on the marketplace to calculate premium tax credits. So just know that it is not, you can't enter some information on Health Sherpa, their marketplace, or whatever it may be, and be like, oh yeah, it's affordable, because they don't have those calculators there. So this is a different formula than those subsidy calculators. So it's a little complicated. So an ICHRA is considered affordable if the monthly premium for the lowest cost silver plan for self-only coverage that's available through the marketplace in that employee's area of residence, minus the monthly amount that they're going to get from those ICHRA dollars. If that amount, so you got your monthly premium, let's say it's $800, the employer is going to give you a $400 for ICHRA, so you're going to say 800 minus 400. Now that employee is responsible for $400 a month. If that $400 is less than 8.39% of their annual household income, then it's considered affordable. If it's more, so if that $400 is going to end up being higher than 8.39%, then it is considered unaffordable per ACA guidelines. And that 8.39% is what it is for 2024. It will change from year to year. I do not know what it's going to be for next year yet, but we should know soon. So next question was going to be, well, you know, the employee has a spouse. I don't know what that spouse is making. How am I going to know if it's considered affordable since it's based on household income? Well, the government realizes that, and they've created safe harbors so that you can determine the affordability factor. So you can use just the W-2 wages of the employee. You can use their rate of pay or federal poverty level. So, or you can just ask the employee, hey, what's your household income? I'm trying to make sure that what I'm giving you is considered affordable. But if you don't want to do that, if the employer doesn't want to do that, or they don't know, maybe they have an employee where the husband and the wife is working, so then they would know exactly what that household income is. But you could, I would probably say the W-2 wages would be the easiest way to do this, because the employer knows what they're paying for the employee on a yearly basis. So that's the affordability portion. Now, if the ICHRA is considered unaffordable, then they can be eligible to receive a premium tax credit if they get their health insurance through the exchange. Now, if they do that, if they go out and get the premium tax credit and their employer is an ALE, so an applicable large employer, that employer is going to be subject to a penalty. So it's not good for the employer if that happens. So it's really important, if you're advising a group, you want to make sure that you're letting them know about this affordability factor, because they're going to want to make sure that when they're deciding on their contribution strategy, that they're keeping these contributions as affordable, because I'm sure they're not going to want to pay a penalty. Now, if it's a small employer, so under 50 employees, and the ICHRA dollars is considered unaffordable, an employee goes out to the marketplace, gets a subsidy instead, they can do that, and there's no penalty for the employer, because a small employer doesn't have to follow the same guidelines as a large employer. Now, an employee cannot choose to get a premium tax credit. The only way they are allowed to have a premium tax credit is if the ICHRA contribution amount is considered unaffordable. And then at that point, the employee has to waive. So another key feature, they have to let the employer know. I would have them sign paperwork that says they're waiving the ICHRA, and that will allow them to get a premium tax credit. Again, only if that ICHRA contribution is considered unaffordable. So if an employee goes out and gets a premium tax credit, it is going to catch up with them. They are going to have to pay back that money when they file their taxes. So again, something that we want to be discussing with the employees as well. ICHRA, if it's affordable, you are not eligible for a premium tax credit. All right, so ICHRA and Medicare. So as you remember, this is exciting for me. So ICHRA dollars can be used to reimburse Medicare premiums. So to qualify for the ICHRA, an employee has to have coverage of Part A and Part B together, or Part C. Again, that's your Medicare Advantage. But Part B by itself, it does not qualify for the minimum essential coverage portion that ACA requires for ICHRA, so that's why it cannot be Part B just alone. It has to be either A and B together or Part C. You can also use ICHRA dollars to reimburse premiums for Medicare supplements, your Part D prescription plan. So, and again, like I had said earlier, an employer doesn't have to allow ICHRA dollars to cover Medicare premiums, but they can choose to, and maybe they just want to pay for Medicare supplement premiums, but they don't want to reimburse for A or B. They can do that, or they can do all four. Typically, if an employer is going to allow the ICHRA dollars to cover Medicare premiums, it doesn't make a lot of sense not to just allow it for all of the parts. And the reason being is, you know, they're paying these 64-year, let's say they have a $700 that they're going to allow be the ICHRA reimbursement dollars for the 64-year-old employees. Some of you might not have experience in the Medicare world, but a 65-year-old on Medicare, typically your Part A is not going to cost anything as long as you've worked at least 10 years where they've taken out Social Security taxes. Then you have your Part B premium, which this year it's $174.70. Let's say they go with a Medicare supplement. The most comprehensive plan for Medicare supplement is Plan G, and in Ohio, that's going to be, it depends on if you're male or female, but it's going to be under $150. And then your prescription plan, most people are on a plan that's going to be less than $30 a month. Again, that's going to be based on what prescriptions they're taking on a regular basis. But all in, all those different parts I just talked about, that's going to be less than $400 a month. So if you're paying $700 for a 64-year-old to go out and get their individual coverage, you might as well allow your 65-year-old $400, cover all their parts, and you're not going to be paying more than $400. So just something to maybe talk about with your employers when they're deciding what they want to do. With a employee for their Part A and Part B, they will have to pay that portion themselves to the government, and then the employer will reimburse the employee for that premium. But they do have to provide proof of coverage, and that would either be their Medicare ID card. I would say more of a Medicare statement, because if they are claiming that they're having to pay for their Part A premium, which can happen in some cases, it's not common, but it can happen, that Medicare statement is going to show what that premium is, where the Medicare ID card isn't going to show them anything. So just keep that in mind. All right, so this chart I created so you can kind of see the differences between benefits, pros, cons between a traditional group health plan and an ICHRA. So the first row, we're going to spend a little bit of time here. The first row is going to be about plan selection. So what can be considered a con is that an employer is going to go out, choose from all the carriers that are available, and choose, hundreds of plans, and only choose between 1 to 4 plans to make available to all their employees. Most employers are only offering 1 or 2 options. So an employee only has, they might not have any choice, but they might have 2 plans to choose from. So not a lot of options there. You're not going to make all your employees happy. Maybe they're going to be upset that you chose one carrier versus the other, or, maybe an employer is deciding that they only want to make HSA eligible plans, so those high deductible plans available to their employees. And employees like, I want to have a copay when I go to the doctor, but they don't have an option. So that can be a con for the traditional group side of things. With an ICHRA, an employee has there are counties that have close to 100 different plans available. So, but pretty much I could say every county is going to have 50 plans or more for the most part. So that means an employee has all those plans, all those carriers. They get to make the choice as to what's best for them and their family. So that's definitely a pro for the ICHRA side of things. All right, next thing, premium payment. So right now, an employee does not have to, if they're on a traditional group health insurance plan, they don't have to upfront any money to pay for that health insurance. The employer pays that monthly premium, and then any portion that's above the contribution amount will be deducted from the employee's paycheck. And as long as they have the Section 125, it's going to be deducted pre-tax. With an ICHRA, the traditional way of ICHRA, and I'm going to have a solution for this, but just to kind of let you know, let's just say the employer is managing this ICHRA all on his own. An employee is going to have to front that whole monthly premium on their own. Then they're going to have to submit proof of coverage to their employer, and then that employer is going to reimburse the employee for the ICHRA part. That could be a lot of money. Some employees might not have $500, $600, $700 to pay up front for health insurance, but that's the way it's done with an ICHRA. They pay them the monthly premium up front, and then the employer is going to reimburse them. All right, so policy ownership. If an employee leaves an employer, they lose that group health insurance plan unless it's a company that's eligible for COBRA. So then the employee will then, at that point, have the option to keep the group health insurance plan, have to pay full price and a 2% administration fee. And maybe that employer had a pretty rich plan, so that means that plan is going to be significantly costly, and an employee just might not be able to afford the whole amount on their own, but that was the only thing that was available because that's what the group had. So, and then let's say, okay, they're like, I just can't afford to pay this really costly group health insurance to keep it with COBRA, so they want to go out and just get their own coverage. Well, now their deductible is going to reset. So maybe they were really close to meeting their deductible with their group plan that they had. They left that employer. They went ahead and went on the marketplace, got an individual plan, and their deductible resets all the way at the beginning. So pretty crappy, but that's how that works with a traditional group plan. With an ICHRA, an employee owns the plan. So they own that individual health insurance plan, whether they got it through the marketplace or got it direct through the insurance carrier, it's theirs. So if they leave the group, they can just continue paying the monthly premium instead of the employer giving them some reimbursement dollars. They're going to pay the whole thing from then on, but they don't have to worry about their deductible resetting. Everything's in place the way it's been. It's just that the whole month's payment is going to be through them. So that can be considered a pro. Medicare, traditional group health insurance plans, there's no option for employers to pay Medicare premiums on a traditional group health insurance plan. So it's more expensive for Medicare eligible employees if it's an age-banded plan to be on that health insurance. If it's not an age-banded plan, then it's going to be more costly for the employer. They're paying a lot of money for anyone that's over the age of 60 on a group health insurance plan. So that's definitely a con there. So pro, like we just discussed, ICHRA, employer can pay premiums to cover A, B, C, D, and Medicare supplements. Budget control. So I know from being in the industry, a lot of times, even like my small groups, they wanted to be able to budget for multiple years at a time. And especially for a small group, carriers don't make it an option to have multi-year group health insurance plans for the most part. So they can't budget for more than 1 year at a time. And then also they don't even have much time to budget for the following year because those renewals, especially in Ohio, come in so late in the game. And there's just not a lot of lead time for employers to really have a look at what's available, what the renewal was, and the budget. So if they, the budget control just is not there with a traditional group health plan. With an ICHRA, an employer doesn't have to change their contribution amounts from year to year. So they can just determine, like, this is what we're giving and this is what we're going to, they can have like a 3-year budget if they want and say, it's not going to change. This is what we're contributing for the next 3 years to our employees. So they can have a multi-year budget. There's no surprises for them. Participation requirements. So with traditional group health insurance, typically there is a participation level that has to be met in order to qualify. There we go. In order to qualify for to even enroll to have a group health insurance plan started. So, and sometimes groups can't meet that participation amount, whatever it may be. It's different based on carriers. Typically, it's at least 50%. And then, of course, it's net. A lot of times, it's net acceptance. So, if if an employee is going to be on their spouse's plan, that won't count against participation amount. But sometimes you just have people that are just like, I don't want health insurance. I'm not paying for it. I don't want it. And that's going to hurt those requirements for that employer and could potentially stop them from being even allowed to get a traditional group plan. So a con for the traditional group side. ICHRA, there's no participation requirements. We can have as little as just one employee accepting the ICHRA dollars, and we're good to go. So that's a great thing with the ICHRA. So if we have groups that aren't meeting those participation requirements, we definitely want to bring up the ICHRA as a solution for them. Contribution requirements. Typically, carriers do require that an employer contribute at least 50% of the employee-only premium. ICHRA, there's no minimum or maximum contribution. An employer could literally only contribute $1 on a monthly basis. I don't know why they'd want to even start one if they're going to do that, but they can. They are able to do that. Another con, which I actually unfortunately don't really have a solution for, and this is the only con. This is literally the only con I see of all of ICHRA, is this one right here, the network. So with traditional group health plans, as long as you didn't put that group in an HMO plan, they have pretty good broad networks. As long as they're on that PPO or POS is chosen, they are going to have a great network. Unfortunately, in the individual market, all plans are HMO at this point. So networks are going to be much more narrow. So if you do go this route, you want to make sure that you're reviewing with the employees what doctors are important to them, so that when you're providing them the quotes from all the different carriers, you're letting them know that, hey, this doctor is going to be in network with this carrier, but not in this carrier. So that's really important to review with the employees, but it's definitely a con to have an HMO network. But unfortunately, that's just the way it is in the individual health industry. I will say the one carrier, and better, if you don't already know, and I'm not promoting them or anything, I'm just letting you know that they have a really good network as far as they're the only carrier currently, and I'm hoping that more catch on to this. But as long as they have a network in another state, so let's say your employee's in Ohio, Ambetter's in Florida as well, they go to Florida maybe for a couple weeks out of the year, they will have a network in Florida as well. So as long as Ambetter has a network in the state that the employee is going to, they can use that network in the other state. So they still want to make sure they're in network with Ambetter in that state, but they can go to other states and have a network available to them as long as Ambetter has a network in that state. So I feel like I was choppy explaining that to you, but just know that's with Ambetter. And every time I get a chance to talk to other carrier reps, I always bring that up to them because I really want the other carriers to catch on to that, because that's really awesome. So, all right, employee experience. Con. Employees are subject to the needs of the many versus what fits their needs when they're on a traditional group health plan. So an employer has to select those 1 to 2, 3, 4, maybe 4 plans. Maybe they have 80 employees, and all 80 have to, we're condensing all 80 employees into just, here's your 2 plan selections. I hope one of them is good for you. So definitely there's going to be employees that are not happy about that. So really that lessens their experience with their benefits to that employer because of that. So ICHRA, an employee is empowered. They have the choice in their hands. They get to choose what plan that's going to be best for them that they want. They get to choose the carrier that they want to have in their lives. So definitely a pro on the ICHRA side. And then I'm sure there's some more pros and cons, but this is kind of what I came up with for the most. Employer experience. So an employer has to spend a lot of time with traditional group health insurance. They have to spend a lot of time reviewing the renewals, poring over their budget, selecting the plans to offer. And I used to help my employer choose which plans to offer for all the employees that he had. And it is a struggle because you're like thinking about things that you do know about the employees, and you just want to, most employers do want to do what's right for their employees. And so if those employers especially are just going to be spending a lot of time, really poring over what plan options are available to make sure that they're making the best decision for 50 people, 80 people, 100 people, whatever it may be. There's never going to be one decision that's going to be good for that many people. So that would be a con on the traditional side. So they're having to spend a lot of time figuring that out. Pros with ICHRA, employer's not going to get involved in that. They're going to set their budget. That's their contribution. They are done. Employees are going to deal with figuring out what plans are best for them. So that's a really great pro with the ICHRA side. All right, regulatory, man, I've talked a lot and we're like not, let me look here, see how many more slides I got going on. I'm worried about time. So, all right, regulatory considerations. ICHRA is a self-insured group health plan, and it is subject to the same laws and regulations as a traditional group health plan. So they have to adhere to IRS guidelines, ACA guidelines, ERISA, COBRA if they're over 20 employees, HIPAA. So that is something to consider as well. So they got to make sure that they are complying with all those different rules and regulations. One thing I do want to say, this bottom paragraph is really important. Individual health insurance plans are not subject to ERISA, and they are not ERISA compliant, which is fine. That's fine, because the ICHRA itself is compliant. So if an employer gets involved with trying to help their employees select their individual plan, or maybe they're telling them that, oh, you really want Anthem, they're a great carrier, they did so great, they can't do that, because at that point, they're going to inadvertently create a group health plan that is going to be subject to ERISA, and we know that those individual plans aren't ERISA compliant, and now they're going to subject themselves to some penalties. So it's really important that the employer stays out of the employee's choices. They cannot recommend, get involved, mandate. They need to stay away from that. Don't talk about what's available to your employees. So that is your job as the broker to make sure you let your employer know that. Don't get involved. That's what they're using you for as a broker. You're the person, or you're going to be working with someone else that's going to help them figure out what they want on an individual basis. So compliance documents, ICHRA compliance, there's a notice that it has to be given to the employees at the time that the employer is going to set up the plan, and then annually 90 days prior. So with ICHRAs, they all are going to renew January 1. So an employer can go ahead and get a plan started right now for a 10/1 effective date, but it's going to be a short plan year, and it's going to renew January 1. So in October of every year, October 1, we want to make sure that the employer is giving out that ICHRA notice to their employees. So we don't have to follow the 90-day rules initially, but annually we do. ERISA compliance, plan document, SPD, COBRA notices, HIPAA notices, Form 5500 if there's 100 or more participants as of the first day of the plan year. Participants, not employees. So every belly button would count towards that 100 or more. Section 125 set up if they're going to have the employee's portion taken out pre-tax. ACA compliance, the 1094, 1095B, that's due every year. or 1095C if it's a large employer, PCORI fees, Form 7200, SBC. So there's a lot of stuff here that we got to make sure that the employers know about and that we're helping with. Let's see. Another really important fact. This is, I'm just looking at the time. Okay. So this is kind of all over the place if you're doing some research or you talk to different vendors, but I have done a lot of research on this. So per the government rules, if an employer, or I'm sorry, if an employee has they get their health insurance or individual health insurance through on exchange, so through Health Sherpa, healthcare.gov, whatever it may be, the state exchange, they cannot have their portion come out of their paychecks pre-tax. It's not allowed. Very clear language. It's against the Internal Revenue Code. But if they get their health insurance direct through a carrier, so off exchange, then they can have their portion, so whatever that monthly premium is, minus what the employer is going to give them in the ICHRA dollars, that leftover amount can come out of their paycheck pre-tax as long as the employer has a Section 125 cafeteria plan. So very important to note how the employee gets their individual coverage does matter for the purposes of whether it's pre-tax or not their portion is. All right, ICHRA compatibility. So that's a big question. Who should I be marketing this to? What industries are good for this? I say all industries are a good fit. I really think that because there's just so many great features of the ICHRA. But what is the employer trying to do by switching to an ICHRA or even looking at it? So these are the bullet points I would say that these are going to be your best fit. Employers looking to control budget. Employers that they got a big renewal. Maybe they have some sick employees and their renewals are through the roof. They need alternatives. Great, let's look at the ICHRA. They're looking to have a plan. They don't want a regular traditional group plan, but they want some tax-friendly benefits, ICHRA. They don't want to manage the risk of a group plan. They currently don't have a traditional group health plan, and instead they've increased their employees' salary or they're giving them a stipend to help pay for the health insurance premiums. Well, that's not tax-friendly way to do things. They're going to have to pay payroll taxes on that money. The employee is going to have to count that money as income and pay taxes on that. So if they're already doing that, let's get them on an ICHRA. There's really no reason not to have an ICHRA in place at that point. Maybe they're not able to get a group plan because of participation. Maybe they've never offered health insurance before. Let's definitely tell them about the ICHRA. They're just looking for a more flexible, simple, and customizable for the employee's way of doing things. Let's look at the ICHRA. Or for whatever reason, they don't qualify for group coverage. Maybe they have some really unhealthy people. They're not able to get those level-funded, self-funded MEWA plans. Their only option is an ACA group health plan. Let's look at an ICHRA because in Ohio, ACA group health insurance premiums will definitely be more than individual health insurance premiums. So let's look at that ICHRA. Not a good fit. If they're already on a really great group health plan and it's pretty low, then they need to stay. We're not going to look at an ICHRA for them. Maybe their employees are already on their own getting big advanced premium tax credits. Maybe whatever ICHRA dollars that the employer is going to contribute to is not going to be as much as what those subsidies are. Maybe we don't want an ICHRA for them at that point. And then single member S Corps. They are not allowed to participate in ICHRAs and ICHRAs. So if it's an S Corp and they have other employees, then their employees you can have an ICHRA and the employees can participate, but the owner of the S Corp, their spouse, and any shareholder that's over 2% cannot participate in the ICHRA, but you can still have it in place for your employees. All right. We got 5 minutes before it's over, but we're going to stay on to answer questions. So the Cornerstone solution, we partner with multiple payment platforms to make the whole process a lot more simple when implementing the ICHRA. So what that means is one of those cons when we were looking at that chart was that the employee is going to have to upfront that whole monthly premium and then submit for reimbursement to their employer, and then the employer has to reimburse and keep track of all of that. Well, our payment platform is going to take care of that con. So that means the payment platform is going to pay all the insurance carriers. So if you have 10 employees and they've chosen 10 carriers, the payment platform is going to pay each of those 10 carriers whatever that monthly premium is for that employee. So no upfront cost for the employee. Then that payment platform is going to send an itemized bill, to the employer, and the employer is going to pay that on a monthly basis. So, and then any portion so the difference of whatever that ICHRA dollar amount, and what that premium is that the employee would typically have to pay is going to come out of that employee's paycheck, either pre or post, based on how he got it enrolled and if there's a Section 125 in place. So this is going to look just like the traditional group health insurance plan. So this is going to be easy peasy for the employer and the employee. No upfront cost for the employee. Employer's used to paying the itemized bill, and that's how that's going to work. Each employee is going to get an account number from the payment platform that they're going to use that to purchase the individual coverage as well as set up EFT. So they, again, don't have to worry about any money being taken from them upfront. The payment platforms will provide reporting, tracking, whatever is needed for the employee. And any paperwork that's needed, we can get that generated from the payment platform. All right. We are here for you, because when you win, we win. I know that's kind of cheesy, but it's true. We want to support you. We want you to get these sales to help your employers, because it makes us, when you're successful, we're successful. So we want to make sure that you feel confident in marketing the ICHRAs. Literally, I am here for you. Any questions, anything you need, reach out to me. You want me to go with you on an appointment with a group? I'll go. You want me to talk to them over the phone with you? I can do that. Video call, whatever you need. I'm going to create a proposal for you, so that's one thing less that you have to do. I will take care of that for you. I'm going to make sure that all those compliance stuff that we talked about in that slide, I'm going to make sure that you and your group knows, hey, it's time to do this, it's time to do that, make sure you look at this, or here's a form for that, here's a report for that. I'm going to do that for you. Anything consulting for the individual employees, if you're not an individual broker and you don't sell individual policies, we can do that. We'll do it for you. Since we're doing it, all the work, we would give you a 20% referral fee. So again, we're able to do that. If you are an individual agent, no big deal. You're going to do that part. If you need to have an issue that comes up while you're doing the enrollment, you can reach out to me and I'd be happy to help you. If you are an individual agent, I do encourage that we are your GA for all those different carriers. We get overrides, but also that makes us available to you if you have any issues throughout the year with that employee and the carrier or whatever it may be. We can kind of come in and help with anything that is going on. If you don't sell Medicare and you have a bunch of employees that are Medicare aged or aging up to that Medicare, we can come in and take care of that as well. And then again, if we are doing the enrollment, you would get a percentage of the sale as the referring agent at that point. So costs associated with installing the ICHRA and using that payment platform that we partner with, it is $40 per enrolled employee per month. Part of that goes to the payment platform, and part of that goes to Cornerstone for us being here and consulting and, all the ways that we're going to help you throughout the year. So we never want you to have to turn away a prospect because you're not able to do something or you're not feeling confident in it, or it's just above your scope. We want to help fill in those gaps so that you never have to turn anyone away. So even if you have no experience in group, individual, Medicare, but you just want to help some people, or you think it's a good idea for your friend or your neighbor, call me, we'll figure things out, and because you're referring business, you will get a percentage of that. So how to get started? Oh, it's 11 o'clock. Okay, real quick. So if you have an employer, you know that they want to have an ICHRA, we want to get a proposal out. What is those numbers going to look like? So you're going to send a census to me, first name, last name, gender, tobacco user, zip and county of residence, annual income, important because we have to check that affordability factor, so we do need annual income. The copy of their last renewal and their current contribution strategy. If they're a virgin group, obviously there's no renewal, and just what does the employer thinking of budget-wise for contribution, and then I can come up with a proposal, and we can adjust it once I get it out, but at least they get some real numbers in their hands. If they say, yes, let's go forward, setting up an ICHRA, the employer needs to determine what date they want that to start. It needs to be minimum of 30 days. Unfortunately, ICHRA does take a little bit longer to get started than a traditional group health plan. A lot of times with traditional group health plans, we can even retroactivate. ICHRA, we cannot retroactivate. So we need to get started. So right now, if you came to me and said, Lael, I have a group, I think they're going to be great, let's get this started for 9/1, I'm going to say, sorry, we're a little bit too late, but we can do 10/1. Then the employer is going to determine what classes they want, the contribution amounts for those classes. Again, that's going to be on the proposal. Maybe they just want to go forward with whatever the proposal says, or maybe they want to change things. Then we're going to get that ICHRA notice to the employees, and we're going to set up the company and that payment platform with one of the vendors that we're using. They're going to enter their banking information in that platform because the first payment has to be paid to the vendor platform before we actually enroll employees in the plans. And the reason being, if it's $2,000, $3,000, $4,000, the vendor doesn't want to front money to a employer group that they have no prior relationship with. They don't know if they're going to get paid. So that just has to be done up front. So, and then once that's done, then the employees will get their account numbers, and then we can get those employees enrolled. And then the second invoice will reconcile everything. And so if the initial invoice was too much, they'll get a credit. The employer will get a credit. If it was too little, they'll owe a little bit more. And then going forward, it should be all set. All right. Oh, I made it. Okay. 2 minutes over. I'm proud of myself. So that's really it. Any questions you have, like I said, we're going to go over questions now. If you can't stay or you want to have a personal question or whatever it is, here's my information. So call me, email me. I'm here for you. I personally want you to be successful, and I'm really excited about the ICHRA product. It really is going to cover a lot of needs that employers have not had available to them in the past. So I know it's a lot, but you're not by yourself. I am here for you. So I will make this as easy a process, not only for your employer, but for you as well. All right, so let's get to the questions. All right. Can you please email out the presentation slides? So there will be a recording of this presentation available to everyone who registered, and so you will get that in 1 to 2 days. All right, can an employee contribute to an employee's HSA if the employee picks the HSA plan on the individual plan? Yes. Anybody can contribute to an HSA. I mean, you can have your neighbor put money into your HSA. Just make sure that you're following the guidelines and don't go over the max, whatever that is. But yes, an employee can choose to fund HSAs. Again, another reason why we want to do an ICHRA premium only, because if you don't do the premium only ICHRA, it gets a little fuzzy because, as you may or may not know, HSAs plans, you can't have first dollar premiums or first dollar expenses paid out. So it just gets a little fuzzy. So I would always recommend, and also with our payment platform vendors that we use, they only allow premium only ICHRAs. They're not going to help take care of a ICHRA that's going to fund medical expenses. So that would be a whole nother administrative nightmare. So yes, they can fund HSAs. All right. Oh, what happened here? Well, I'm really confused. Okay. Oh, I guess when I click, okay. To discuss MEC plans versus ICHRAs. All right. So an ICHRA is a MEC plan. I mean, all plans that meet essential essential criteria is a MEC. But I know what you mean. You're talking about those MEC plans that are like $40 an employee. It's literally covering only the preventive wellness benefits. It is not great for an employee, but it does help an employer avoid the penalties for not offering ACA compliant health plan. So really the difference is you're offering your employee a better benefit by having ICHRAs available to them. So MEC, like if we're on the same page, like your minimum MEC, there are a couple different levels, but your minimum MEC is just not good for your employees. So it's just covering, you know, the preventive and the wellness and just a few things. So I would always recommend an ICHRA over a MEC because personally, I think it's not nice to offer a MEC to your employees. So, all right. But we can talk more about that if you want. You just call me or email me. But yeah. All right. Is the $40 per employee Cornerstone fee for setting up, and actually I'm going to do this over here. Okay. Is the $40 per employee Cornerstone fee for setting up the ICHRA, or is that for enrolling the employees? Okay. The $40 fee per employee, enrolled employee, is for the administration and consultative fee. So that payment platform we're using is going to get part of that on a monthly basis, and then Cornerstone gets another part of that for the consultative piece, for my time and work and all of that. So I'm not getting it directly, but it's going to Cornerstone. So that's what that is. It's not for, there is no fee to enroll employees. It's just that if we do the enrollment for the individual employees, then it's going to be in our name. So we're going to be the AOR. And then at that point, you would be considered a referring broker. And that's why we have a program set up and you would get 20% of that. So that is separate, two separate things. But the $40 is just to have the ICHRA in place where we're basically managing it for you, helping you with it in whatever way you need us to. And then there's also to have that payment platform vendor that we use to have them in place as well, because that's a big piece of this to make this super simple. Hopefully that answered your question. Is that fee to be paid by employer or broker? Oh, no, the broker's not going to pay anything. It's part of, so on traditional group health insurance, there's a commission that brokers get for that. It's usually between $30 to $40 per enrolled employee. So just think of it like that, because that's essentially what it is. It's just that commission for having a group health insurance plan in place. So no, a broker doesn't have to pay anything to use us. It's going to be on the employer, and it's spelled out. It's not hidden. When I run the proposal, you'll see one of the lines will talk about the admin and advisory fee. So again, if they are already on a traditional group health insurance plan, they're paying that. Whether they know it or not, they're paying between $30 to $40 per enrolled employee, and that goes to the broker that wrote it. All right. Is the ICHRA money to the employee taxable? No. That's why this is so great. It's pre-tax benefit, or it's the employer doesn't have to pay their payroll taxes, and it's not counted as income for the employee. So no, it's not taxable. Oh, that came, okay, now I see it happened. Is the $40 per employee? Okay. Can you please email, okay, we already talked about that. Can an employee contribute to an employee's HSA if, I already answered that, that's yes. Is that, hold on, I'm a little renewed. This question part's stumping me a little bit. Hold on, I just want to make sure I'm reading all of these. Money to the employee taxable? No. Talked about MEC. $40 per, we talked about that. Can you please email? We talked about that. Can an employee, yeah, we already talked about that. All right, can an employee have one ICHRA? No. Okay, here's the question, sorry. Can an employee have one ICHRA class for a 65 and over employee? So Medicare itself is not one of the 11 classes. So no, that would be wonderful, but no. So you can just make that available to your employees that are Medicare aged. You're going to make the ICHRA available to those Medicare eligible employees. But no, it can't be a separate class. So you can't have a traditional group plan for everyone else and have an ICHRA for Medicare. Unfortunately not. What was I going to say about? Also, you can't pay, the ICHRA dollars can't be different for the Medicare eligible employees either. So if you're contributing $600 to your band of 60 to 64 and they want to have the ICHRA dollars available to those Medicare aged employees for their Medicare premiums, you're going to make available to them $600. However, as we talked about earlier, there's no way for it to get to $600 unless maybe if they had to pay the Part A premium. But again, most people aren't having to pay that Part A premium. So it would end up saving the employer because their max would be most likely not quite $400. All right. What's your experience with carriers' response to employers who have both options, group and ICHRA? Okay. So if you have, let me think about this, how I want to answer this. If you're making the traditional group plan available to maybe just your hourly employees and then, or just your salary employees, and then you have an ICHRA for your hourly employees, if you don't already have that plan in place, you're probably going to have an issue with meeting your participation, because then at that point the carrier is going to say you're not meeting participation, and ICHRA is not one of the excusable, it's not one of those compliant, I can't think of the right word, but you know, it's not going to be part of the net. Oh, I'm on ICHRA instead. Okay, good. No, a carrier's going to be like, no, you're not meeting participation. If you already have it in place, how's the carrier going to know that? Not that I'm saying you should be dishonest carriers, but I mean, you're not going to call them up and say, hey, Aetna, I got an ICHRA now for all my hourly employees. I'm dropping down to 3 salary employees. You know, you're not going to do that, so they wouldn't know. But at some point, if carriers do have like some sort of, sometimes they want to reconcile your group plan, or if they take a look at what you have, it could prove to be a problem later on. But yeah, as long as you're not like telling them like this is what I'm doing, they're not going to know the difference. They're just going to see that a bunch of people fell off. But starting up, you definitely have an issue because you're not going to meet the participation. So, all right. One second here. What happened here? Okay. Does an employee receiving a subsidy have any impact? Yes. An employee that is, so again, if the ICHRA dollars is considered affordable, an employee cannot have a subsidy. So that's the impact. But if the ICHRA contributions is not affordable, then they can have a subsidy. So they are not allowed to have a subsidy if they have affordable ICHRA available to them as an option. I think, I don't. All right, Kim wrote, I don't think you could have 2 plans side by side. Carrier wouldn't permit. A carrier might have a problem with it, but ICHRA does not. So you can have a traditional group health plan in place and have an ICHRA as long as it follows those guidelines that we talked about. So make the ICHRA available only to new employees, and the health insurance stays there. And then Yeah, so that's really a carrier issue. ICHRA allows it. So the carrier might have an issue with it if they know about it, but it is allowed per ICHRA guidelines. So you can have a traditional group plan in place and an ICHRA in place. It's just that you can't offer the option to one employee, a class of employees. It's either traditional group health plan for all my current ones, ICHRA to my new employees, or we're going to have a traditional group plan just for the full-time employees and an ICHRA available to part-time employees. So you can have both in place per ICHRA guidelines, carrier guidelines, that's something else. And I can't speak for every carrier. And like I said, that's just going to be based on, what they have. So that's that answer. And you can't offer the same You can't offer the same class of employees choice. I think I just said that. So if you're making the ICHRA available to your full-time employees and you're having an ICHRA for your part-time, a full-time employee can't come to you and say, hey, Mr. Employer, I want an ICHRA like that part-time employee is getting. They don't have a choice. So a class of employees, no one can have a choice between one or the other. It's the employer determining what class is having traditional group plan, what class is having ICHRA. And I think, hey, Jess, are you on the phone with me still?
Yeah.
Someone has a raised hand, and I don't know what I need to do with that.
Sure. It looks like, okay, I don't see their question in the question box. If you did use the raise your hand feature, go ahead and write your question in the question box, because unfortunately we can't unmute you. So just leave it there and she'll be able to read it out loud and address you.
Yeah, and if it's something that you think is too complicated to be typed out, because I know that sometimes I'm like, oh, I don't have time to type this whole thing out. You can call me, email me. I can answer any questions that you have that maybe you just didn't feel like typing out. And I have stayed on a couple more minutes, but I think I covered all the presentations. Thank you for everyone that posted some nice comments to me. I'm not nervous anymore. So and Jess, I'll let you tell me when you think we should just go ahead and end this, because I'm not seeing any new ones pop up.
Sure. Yeah, if you have any additional questions, we'll go ahead and end it here.
Okay.
Just go ahead and speak with her directly. All right. Yeah, it doesn't seem like we're going to get any more. So go ahead and close us out there, Loyal.
Okay. All right, everyone. It was really great talking to myself while you were listening, and hope to hear from you soon.